Hey, hi, it's Bob Boross, and this is my jazz and tap dance life. I'm into day number 9 now of my knee replacement operation, and I'm going to talk a little bit about what's going on now since the last time I checked in, which was last Friday. Of course, if you've been watching me in the past, you know that right now, no more beard. It just had to go. I've had the beard for a couple of years. And I've been thinking about like what my body feels like now that I'm going through this, between all of the swelling that was in my body, the support stockings that I have to wear to squeeze it in. I'm just not doing well with like things being humid and hot. So I just felt very encumbered. And I just said, I just feel like shaving this off. And I thought about it for a day or two, and I said, that's it. So it went. So I'm back to me now. And I do like it. I feel much better in having all of this on me. Right now, I just don't want anything pressing on my body because of what's going on. So yes, into day 9. And I've had some improvements since I last checked in last Friday. It's an interesting improvement because I can do more on my exercises. I can feel a little bit stronger. I can walk a little bit better, but that knee is just stiff, stiff, stiff. Like it doesn't stretch and begin a little bit more loose and a little bit more loose. I can get it to stretch and then it goes back to being stiff. The swelling is down, which is good. Certainly not gone all the way, but it's definitely much better. So the first thing we're going to do is take a look at this leg. All right, so this is where we're at right now. Okay, now as you can see, the knee from one to the other is actually fairly close, whereas before, the last time I checked in on Friday, this was like a sausage. It was just one big tube. I do have some little definition here into the shin, down to the ankle. My foot is still a little bit fat. And that, of course, from walking, that's going to take all of the swelling. I don't have my sock off here. You'd be able to see it a little bit more in there. Okay, but I still have the bruising on the inside of the thigh from the tourniquet. I have it in the back. Now I can see that. I don't know if you can get a good view of that. In the shin. But here's a new one, which I just noticed, just like the day yesterday or the day before, was all in my ankle. And I didn't know what that was from. I was wondering if maybe there was a clamp they put on my ankle to hold the leg absolutely still while they had to do the operation. When I showed it to my therapist yesterday, she just said, no, that's because of the incision that they make, and there's bleeding, and the blood eventually will pool, so as you're standing, it comes down. So, it's a little tender in there, but I did not expect that, and it looks pretty bad. So that's kind of an interesting thing that would happen from there. So pain, like I can now like press in a little bit. I couldn't do this on Friday. It was like a drum. So if you can see what I'm doing there, so that's the swelling is gone. So those are all good things that I can do. I know that this area of the quads right above the kneecap is extremely, extremely tight, especially here on this outer portion of the leg. So if I want to bend my knee in and the therapist is bending it right here, it just does not want to give, and it fights and it fights and it fights. So I can spend some time doing some easy massages on the muscles, try to get them to move a little bit more. I couldn't do that a few days ago. So these are all good things that are going on, but I obviously have a lot more to go before this gets better. Exercises are doing great. I mean, they're very simple. I'm going to be just laying here on my sofa and have your legs straight out and bending the knee in, and she'll push, and drop down. And then to lift straight up in front with a straight knee, my God, that was so painful the first day. Now I'm up to 2 sets of 10, because we went with 2 sets of 5 and then 3 sets of 5, and now I'm up to 2 sets of 10. So that's getting better. Then going out to the side and out and in on the leg. I'll do very similar exercises sitting. Then we'll add like basically releves is what you're doing, pressing the heels off the floor, some marching, and a few other things. So that's just basic movements, and they do get better. They get a little bit stronger, but still that knee does not want to bend. It will get a little bit better through the exercises, but then 2-3 hours later, it feels like it just goes right back. Walking is pretty good. I can take longer strides. I just have the tips of my fingers on my walker, and I really don't need it. I'll take 4 or 5 steps on my own when I'm in the kitchen, things like that. But I'm not going to just like ditch the walker and be completely on the leg. I did have some pain in my lower back on the left side. And she said that's coming from because I'm really working on that leg and favoring that side, and I'm mostly my weight is shifting to the right. So that's a little bit better today. So that's kind of cool that's working. I did get outside yesterday for the first time in over a week. I live on the second floor in a condo, and we had to do the stairs. So going sideways on the stairs was pretty cool. And you just face directly stairs, put your hands on the rail, step down with the bad leg, and then step down with the good leg, then down with the bad, etc., and then reverse it on the way up. So that was kind of an easier exercise. That was not hard at all to do. It's a lot harder just to try to straighten my knee, to straighten it out straight in the front and bend back in. That is the hardest thing that I'm trying to get through. So pain has been, all right, that's something I can go back to. On the last time I was like, great, I got off the oxycodone, and no, I had to go back. It hurts. It hurts before the exercises. I'll take still a pain pill. At nighttime, I'll take one before I go to sleep. Usually I wake up after about 3 hours. I'll take another one. So that pain is kind of still there, and you don't want to just have it all the time. Of course, you're worried about any type of addiction, and my therapist said, with this oxycodone, she says for 3 weeks, no problem, don't worry about that. You need to take it to stop the pain, because when you stop the pain, you will move your muscles more. Otherwise, when you're in pain, you're not going to work them, and they have to be worked now, because right now the body is just sending scar tissue like crazy to that area, and you have to counteract that and keep it moving until the swelling goes down, and hopefully you'll get a little bit more movement once there's more healing that's going on. So I'm still using the oxycodone at this point, but still as little as possible. During the day, if it's not bothering me quite as much, I won't do it. Definitely feel best when I just lay down, put the ice machine. This is the ice, there we go. This is the ice pack that wraps around the knee, and the cold water flows through that. So as long as I have that on and just relax. So either I'm exercising twice a day, doing walking, or just laying flat and resting and relaxing. There's not much else I can do besides that. And I like to just relax and calm down and think about the knee and just let it do its thing, because I know it needs time to heal from there. One thing I've been thinking about too is, like I said, this is my jazz and tap dance life, and I've been dancing this way for 45 years. I started when I was 20, I'm 65 now, and teaching for 40. And very seriously and consistently, even in my 40s and 50s and up till just recently. So just thinking about, what we do as dancers and how we push our bodies at times when it's not able to be pushed anymore. I know a lot of people who are dancers will, have their big career. By the time they get in their 30s, early 40s, they're really tailing off or even stopping. Your body is a little bit more stronger and resilient at that point. To continue to do that into your 50s and even into your 60s, your joints just can't take it after that amount of time. But yet you're still doing it because that's your profession, that's what you're interested in. It's how you make your money. And it's what's required of you. I know from the fact that, like, I was at University of California at Irvine. I started there when I was 45, so I was there 7 years, 45 to 52. The amount of work that was asked of me or required of me in terms of teaching, choreographing, moving, being on my feet, literally it was 6.5 days a week. I mean, I worked 6 days all the time and half a day on Sunday. There was no getting off, resting, relaxing, no 5 days and 2 days off just to take your body off. That's not possible, because of the requirements of tenure, what they were asking, the amount that they wanted you to contribute and to bring forth. So, that's not good. That's not healthy. Maybe it's a little bit easier, if you're going up when you're earlier, starting at 30 years old or 28 years old, But I think that in the university system in particular, and in dance in particular, that there needs to be a lot more attention paid to what can your body do, and what are you doing to your body in order to fulfill these requirements. I don't think that it's right for somebody who's, been dancing already for 30 years, now in your 50s, to be spending 6 days a week on your feet consistently moving without a break, like expected almost like year round. That's not good. A history professor doesn't have to do that. A chemistry professor doesn't. English professor, no one does that. But dance-wise, it's like, yeah, just do that. I always said the best job in the world, be an acting teacher, be an acting professor, okay? You've got everything written for you in the monologue books. You just tell them to figure it out. You sit back, you look at it, you give them some exercises. That is like the easiest job compared to what we do as dancers. So, I'm thinking about like, why is that asked? There should at least be protocols in place to monitor your body. You should be getting x-rays of your ankles and your feet and your knees and your hips and your lower back, like yearly, starting when you're 45, say, and charting that destruction that's happening in your joints so that you can see and say, look, I started doing this when I was 45 with x-rays, and now that I'm 52, there's some significant deterioration, and the deterioration gets faster as you get older, obviously, and you need to adjust. You need to stop. You need to teach different classes. You need to do something different and not push yourself that hard, because for me to say, this is the thing I love, this is this thing I was good at, this is the thing I had a lot of success with, like, why do I have to end up with this? Because of that. Like, there's no reason, just because no one pays attention to it. And that's not right. You should be able to go through a dancing life and still have your body when you're older, and not be full of different devices that have to be, because this is one thing that I'm going through. Once this is done, I'm supposed to get the other one. I need to have the right leg done also. I still have bone spurs on my feet. I had them removed. They're back. So this is all because of just doing the thing that you want to do. And at least in the university system, I'm much more about private teaching, but there needs to be more attention paid to what you're doing to your body while you do this, and to allow you to do the thing you're good at, to continue it without literally destroying your body. I mean, that makes no sense in the long run. And this is, I really wish I didn't have to go through this. I shouldn't have had to. Another thing, particularly, I teach in the mathematics technique. It's a demanding technique. There's certain things that relate to jazz, but Matt did a lot of things in parallel, with the parallel tendu exercise. I don't know if anyone's ever looked at my videos for that when I explained what Matt did. But there's a constant stopping and pushing off of bending into that demi-plie in a parallel position of the leg on one leg, as the other leg works, tendu, front side, back side, and then push off. So you are constantly like bending in, holding the knee, and push off. Bending in and hold the knee, push off. If you're going to do that class twice a week and only do it until you're 40, that would be okay probably. For me, teaching this, and doing it over and over and over and over for so many years, it's just like sandpaper on a block of wood. It's just wearing that joint down. In his technique in particular, there isn't as much of dropping down to the full grand plie. So it's a lot of stopping in that demi-plie, stepping forward into the jazz fourth, before you do the head isolation, different things like that. So you're constantly squeezing your quadriceps, in that half demi-plie position, which means it doesn't relax and go through a bigger range of movement. And now I'm looking at this and thinking, well, that's probably okay if you do it for a short amount of time, but if you're going to do this for a 40-year career, that's probably not good to be doing that. And that could be a contributing factor. I know Matt had very bad knees. I don't know if he had knee replacements. I would like to find out about that. But he always had braces on his knees. And in fact, the first time I met him, he was 65. And, he wanted me to do double turn, drop to the floor. And he couldn't do it himself. His knees wouldn't allow himself. And he was 65. So, this stuff does take its toll on your body. and thinking about, what is my quality of life and what is it going to be like when I'm a little bit older. Maybe we should adjust things. Maybe we should take a little bit more care to protect the body and to look at those aspects of the technique that we're teaching that may be, a little bit, more injurious to an older person. It would be okay for somebody who's very young, but maybe an older person needs to change a little bit. So anyway, that's kind of where we're at. I've got my improvement. I've got a little bit more going. Swelling is down, moving a little bit better. I'm looking forward, hopefully within another week, that this knee will bend a little bit more freely. Oh, that was another thing. As my therapist bends my knee, the benchmark is you got to get to a 90-degree bend in the knee, which I did hit yesterday, although she was pushing pretty hard to make that happen. But she said that's usually a benchmark for 2 weeks out, and I was 1 week out. So that's good. I'm in better shape than a lot of people. But it's got to get to the point where that relaxation and bend happens normally and not from a forced position. So anyway, that's it. 9 days out. Just want to let you know what's going on, and I'll be back maybe in a few days with a little bit more improvement or a little bit more insight into this operation, okay? This is Bob Boross. This is my Jazz and Tap Dance Life. Thanks for watching. If you're interested and not a subscriber, please subscribe to the channel, hit the notifications bell. It's great to hit the like button because that sends it out to more people. If it's seen as a video that's likable, then YouTube will bring it to more people. And I think not only for dancers, but for anybody who's having knee replacement, this would probably be a good thing for them to watch, okay? I know I couldn't find much information. So anyway, that's it. Thanks so much, and I'll see you in the next video.